The increasing cases of drug and substance abuse among persons in Nigeria have become a source of concern to stakeholders in the health sector. This is why the Federal Ministry of Health brought together health experts from different parts of the country to Abuja for a national discourse to seek ways of reducing drug and substance abuse in the country. Permanent Secretary, Federal Ministry of Health, who was represented by Olubokola Ajayi, said the ministry is working round the clock to formulate policies and programs, dangers of drug and substance abuse. The Permanent Secretary also said the ministry is ready to partner with other stakeholders to create awareness and strategies for a drug-free Nigeria.
An estimated 10.8 million Nigerians were reported to have used cannabis in 2017, while 4.6 were found to have used opioids for non-medical purposes in the same year, 2017. The mean age of initiation for cannabis and non-medical use of pharmaceutical opioid use was 21 years and 19 years respectively. That's the mean age when people use. These alarming statistics provide a glimpse into the global drug use situation, which recognizes the growing non-medical use of opioids such as tramadol, codeine, and morphine is a serious health. The need for statistically sound and policy-relevant data on the extent and pattern of drug use to inform policy information and decision-making cannot be overemphasized. Nations are also organized in the immense benefits of implementing evidence-based strategies in the prevention and treatment of drug and substance abuse, as well as rehabilitation of drug users. Concerted efforts are constantly being made to strengthen global action and cooperation towards achieving drug-free society.
National Drug Law Enforcement Agency, United Nations Office on Drug and Crimes, Pharmaceutical Council of Nigeria, Pharmaceutical Society of Nigeria, and other stakeholders commended the ministry for the national discourse, as the event is an avenue to expose some of the causes of drug and substance abuse. They also called on the federal ministry to partner with states and the primary healthcare centers to educate persons in the grassroots on the dangers of drug abuse.
That the scourge of drug abuse globally is at an alarming rate. And we all know that Nigeria is not an exception. And that's why we need all hands to be on deck in order to exterminate or reduce to the barest minimum the scourge of drug abuse in our country. The activities of NDLA is twofold. And number one is drug supply reduction. And the second one is drug demand reduction.
This is a menace that is affecting every family in this country. And that is just the truth. If you are not part of it, you are affected in one way or the other. Apart from that, drug abuse is something that affects every sphere.
The increasing threat posed to public health by these substances must therefore be in the forefront of our national conversation because of the disturbing statistics. But we must realize that in facing the drug problem, we must realize that this is one problem that cannot be addressed effectively if it is not addressed collectively.
Unfortunately, in our system or in our society, you have facilities coming up who delve into the source of these drugs and see them more as items of commerce which you sell like any other thing and not just drugs. Worst of it all is the existence of open drug markets in the country, something you don't have anywhere. So this chaotic drug distribution system form one of the basic foundations to our problem in this country.
The theme for the national discourse is Share Facts on Drug Abuse, Save Lives. Emmanuel Unu, News 24.